Hello everyone, and welcome back to Nurses.not.Doctors, where we learn smarter, not harder. Today we're going to talk about ACE inhibitors, and by the end of this video, you'll understand what they do, why we use them, and what nurses must watch out for. So what are ACE inhibitors? ACE inhibitors are a class of blood pressure meds, and the easiest way to recognize them is they all end in pril. Some examples include lisinopril, captopril, and fosinopril. Their major job is to lower blood pressure. In order to understand how ACE inhibitors work, you need to understand the RAS system, which you can find in one of my previous videos where it is explained in an easy-to-understand way. ACE inhibitors work by blocking something called angiotensin-converting enzyme, also known as ACE. Normally, ACE turns angiotensin 1 into angiotensin 2, and angiotensin 2 is a problem because it tightens blood vessels, raises blood pressure, tells the body to hold on to sodium and water. If your body is functioning correctly, the RAS system is great and very helpful, but sometimes the RAS system is firing when it does not need to be and can cause a lot of harm. This is where ACE fits in. When we block ACE in the RAS system, blood vessels relax, blood pressure drops, and the body gets rid of extra fluid. So think of ACE inhibitors as blocking the RAS system from finishing its whole process. The background we just went over is really what helps us understand the mechanism of action of ACE inhibitors. So ACE inhibitors block ACE in the RAS system, and it stops angiotensin 1 from converting into angiotensin 2. Ultimately, by blocking ACE, we're getting vasodilation, which is decreased blood pressure, so it'd be great for a hypertension patient. And we're also getting decreased fluid retention in the body, which decreases the workload of the heart. So what are the major uses for ACE inhibitors? The first major use, and the most common one, is hypertension. When the heart is beating too fast, ACE inhibitors will slow it down. The second major use is heart failure, because ACE inhibitors decrease fluid retention, which reduces the workload on the heart. What are the adverse effects you must know? These are the ones professors and NCLEX love to ask on tests. The first major one is dry cough. It's also known as the ACE cough. This is caused by bradykinin buildup. If a patient has a consistent dry cough, think ACE inhibitor. This is a common side effect and usually not threatening, but it can be very annoying to your patient. It is important to follow up with your patient consistently to make sure they don't stop taking their med because of this. The second effect is angioedema, which is swelling of the lips, face, tongue, or throat. This is an emergency, and if your patient is experiencing this, stop the med immediately. Third is hyperkalemia. ACE inhibitors increase potassium, so high potassium is a real risk, and patients want to monitor and avoid excess potassium in their diet. Fourth is hypotension, especially with the first dose. Because ACE inhibitors are decreasing blood pressure, it's possible that the blood pressure will decrease too much. It's important to educate your patient on standing up slowly and changing position slowly. Now let's get into the black box warning, and this is very important to remember. ACE inhibitors have a black box warning for pregnancy. They can cause fetal kidney damage or death, so these medications are absolutely avoided in pregnancy. If a patient becomes pregnant, the medication is stopped immediately. Now let's get into what we want to teach our patients. You will also get tested on this quite often. Teach patients to avoid potassium supplements and salt substitutes. Also foods high in potassium such as oranges, bananas, leafy greens such as broccoli. Monitor blood pressure at home if ordered. This is to monitor and see if the dose is correct. Maybe it's not strong enough and they're still experiencing high blood pressure, or maybe it's too low and they're having hypotension. Also, report swelling of the lips or face because that is signs and symptoms of angioedema, which is life-threatening. Persistent dry cough, because sometimes patients will stop taking their med because of this. And also dizziness or fading, because that could be signs of hypotension and the drug might need to be adjusted to a smaller dose. And remember, do not take this if pregnant. Some contraindications we want to watch out for as nurses is making sure your patient is not pregnant because it could cause fetal death, history of angioedema, especially if it was ACE-induced, bilateral renal artery stenosis, it could cause acute kidney failure, hyperkalemia, because ACE inhibitors increase potassium, and severe hypotension, especially risk for first dose hypotension. There are 3 drug interactions to always remember, and they are potassium-sparing diuretics, because they can lead to increased risk of hyperkalemia. These drugs block sodium reabsorption in the distal tubules of the kidney. Sodium usually comes with potassium excretion. Less sodium exchange leads to less potassium excreted, and potassium can rise to dangerous levels. Next is NSAIDs, which can lead to decreased kidney perfusion. The main patients at risk for this is people with low kidney perfusion to start out with, like elderly, someone with heart failure, or someone who is dehydrated. Third is lithium, because you're at an increased risk for lithium toxicity. Lithium is cleared almost entirely by the kidneys, so anything that reduces renal perfusion decreases lithium clearance, so lithium levels can accumulate and become toxic. If you see ACE inhibitors plus any of these, think monitor closely. Now let's look at the big picture and remember the best takeaways about ACE inhibitors. They end in prill. They relax blood vessels, leading to lower blood pressure, but they can also cause the ACE cough, angioedema, which is life-threatening, high potassium, and are dangerous in pregnancy. If this made sense, you're doing it right. Smart learning beats memorization every time. If this helped you, like, subscribe, and share with another nursing student. This is Nurses, Not Doctors, where we learn smarter, not harder. See you in the next video.